A pipette is a laboratory tool used to measure a small volume of liquid. This video will show the types of pipettes, pipetting techniques, tips to improve pipetting techniques, physical influences, and care for the pipettes. Piston stroke or air cushion pipettes consist of a piston cylinder system which performs the actual measurement. When the piston moves upwards, the vacuum allows the aspiration of the sample that is separated from the piston by an air cushion. This type of pipette is strongly influenced by temperature, air pressure, and humidity. Positive displacement pipettes have a tip with an integrated piston coupled to the piston rod during pipetting. The liquid in the tip only reaches up to the hermetic sealing lip. The accuracy in dispensing depends greatly on the disposable plastic tip, and it is not affected by physical influences. The quality in pipetting depends on a good technique and understanding the physical influences. Press the operating button down to the first stop. Immerse tip a few millimeters into the liquid. Release the operating button slowly. Tip will fill up. Dispense liquid by pressing the operating button down to first stop. Then blow out the remaining liquid by pressing the operating button down to the second stop. Replace the tip to avoid sample contamination. Press the operated button down to second stop. Immerse tip a few millimeters into the liquid. Release the operated button slowly and the tip will fill up with the liquid. Dispense liquid by pressing the operated button down to the first stop. Some liquid will remain in the tip and can be discarded. Replace the tip to avoid sample contamination. Repetitive pipetting. Use the reverse technique to pipette the same solution and volume repeatedly without changing the pipette tip, or use a positive displacement pipette instead. Tips to improve your pipetting techniques. Allow the samples to reach the equilibrium with room temperature. If the temperature of the liquid increases, more volume will be pipetted. If the temperature of the liquid decreases, less volume will be pipetted. In particular, for the air cushion pipette, avoid overhandling the pipette as it may increase the temperature, expanding the air inside and reducing the volume aspirated. In general, the smaller the temperature differences between pipette and the liquid, the more accurate the results will be. Choose as small as pipette tip as possible. The bigger pipette tip has a larger air volume between the piston and the solution inside the tip. This decreases the accuracy of the volume measured. Pre-wet the tip 2 or 3 times to raise the humidity of the interior of the pipette. This improves the accuracy of the measurements. In a series of volume measurements, the first tip should be pre-wetted several times at the beginning. In case of changing the tip, it is enough to pre-wet the first tip once, as the humidity of the pipette is already in equilibrium with the solution. Choose the correct tip for your pipette. It must be coupled perfectly to seal tightly. When coupling the tip to the pipette, do not use excess force as this can damage the seal. Immerse the tip only a few millimeters into the solution. If the tip is immersed too deeply into the liquid, small drops form on the outside, falsifying the dispensing volume. If the tip is not immersed deeply enough into the liquid, turbulence is produced, aspirating an incorrect volume of liquid. pipette should be held vertically during aspiration. If the pipette is held inclined, the hydrostatic pressure of the liquid in tip falls. This causes the volume aspirated to increase. Release the operating button with a consistent speed, allowing 1 to 3 seconds for the liquid to rise in the tip. Always keep your thumb on the button. Remove the pipette tip from the solution vertically and slightly tap against the wall on the vessel or container to remove any liquid from the outside. Density of the liquid. This means that when pipetting liquids are denser than water, the volume of liquid aspirated into the tip is typically less than the set volume. Dispensing systems with positive displacement can be used instead. Volatile liquids such as solvents cannot be dispensed with the accuracy and precision specified for distilled water. Use reverse pipetting and pre-wet the tip for at least 1 minute. However, the pipetted volume will always be lower than the nominal volume. Viscosity of the liquid. When pipetting viscous liquids, pre-wetting the tip is difficult and it tends to form droplets when dispensing. This may cause a considerable volume to remain in the tip. Use reverse pipetting. Changes of temperature between the pipette and the solution dramatically affect pipetting and dispensing. Changes in the ambient relative humidity affect the volume pipetted.